Hello, my name is Trina Rose Cereza Fox, and today I'll be performing the skill video for inserting and discontinuing an IV. I do have my Nightingale scrubs badge, and today I'll go ahead and start with hand hygiene, clean gloves, and then our patient today is a 45-year-old male who is needing IV fluids, so we're going to use a 20 gauge 1-inch IV catheter and needle. First, I will start by prepping my tubing. So be sure to be careful not to touch any of the connecting surfaces. Put my caps here, and we're going to make sure that we fill the solution in the tubing, no air. Okay, go ahead and place that to the side. Next, we will apply our tourniquet about 4 to 6 inches above the insertion site. Okay, and we'll make sure that it is not too tight by ensuring that there is still a distal pulse. Okay, we still feel one, that is good. And then now we will alcohol swab in an outward circular motion and discard. Next, we will insert the needle with the catheter, discard, discard. Make sure that the bevel is up. We're going to anchor the vein down about 4 to 6 centimeters from the site, and we will insert. We see flashback, good. Now we will insert another 1/4 inch. Okay, and then we will go ahead and release the hub. Make sure that the hub is all the way at the venipuncture site. Good, and then we will retract sharps, tourniquet, and then just making sure we stabilize the catheter with our non-dominant hand, and then we will connect the tubing. Okay, and then we will aspirate first for blood. Okay, and then we will insert all the fluid slowly. Okay, and then we'll go ahead and remove the syringe. Place the cap. Okay, so we will now put on our tegaderm. Make sure that is nicely sealed, and then we will use our tape to seal the tubing off to the side but still on the patient's skin, but just making sure we're not occluding if we're not obstructing any visual of the insertion site. And we will also place some tape at the top. And then we will place the label on the side of the tegaderm, and that's going to include our initials, date, time, gauge, gauge size, and length. Okay, and then we'll just make sure all of our supplies are discarded, and we will remove gloves, hand hygiene, and document our procedure. Now we're here to discontinue the IVs, so we will hand hygiene, clean gloves, so now we'll go ahead and start by removing the tegaderm, making sure that we hold the catheter in place. And then we will remove our tape. Again, making sure to keep it in place. Okay, now we will grab a gauze, and we're going to hold it at the insertion site while we remove our catheter. We're going to hold this here for about 30 seconds or more. If we just have to make sure that there is no continued bleeding, making sure our catheter is still intact and the length is still good. We will discard into sharps. And now it's been 30 seconds. We'll go ahead and there's no more bleeding. We'll discard, place another gauze at the site. We'll tape it in place. And we will remove gloves, hand hygiene, and document our results.